Hi, everyone, and welcome to today's session, Virtual Simulations and the Impact on Clinical Judgment. My name is Hannah Lawless, and I lead up partnerships here at Labster and our newly acquired nursing program, UBSIM. I am just thrilled to announce our wonderful speaker today, Dr. Amber Kool. Dr. Kool, how are you doing today?
I'm good. How are you?
I'm good. I'm excited to get into today, and I'd love to just dive in with a general introduction. I know you wear a lot of hats, so if you could just share a little bit about who you are to get us started.
Yeah, absolutely. So I have been a nurse since 2012, and my background is pediatrics primarily. So I worked in a NICU. I have some mental health experience. And then in 2016, I became an adjunct clinical faculty. So I started teaching for Arizona College in 2016 and moved into a full-time faculty position. And then, we nurses love to be lifelong learners. So I've just continued degrees and kind of extending that. And that took me to American Sentinel for my DNP, where I studied virtual simulation and the impact that it can have in experiential learning and clinical judgment and kind of improving outcomes for our students and the profession.
Awesome. And I mean, I know you've spent quite a bit of time, even just by that overview, studying very specific different parts of simulated learning and the interaction there, specifically Kolb's experiential learning theory, which is so fascinating based on what I've already read about it. From what I know, there are four defined stages of theory. Can you tell me a little bit about them?
Yeah, absolutely. So the first stage is a defined experience. So that can happen in a lot of different learning modalities. We can use it in didactic, we can learn it in hands-on labs, clinical experiences. Basically what we're saying is when you come here, we're going to tell you exactly what's going to happen and you're going to the focus of the learning. We also then move into stage 2, which is observation and reflection about what they just experienced. So one of the key pieces that's very, very important, it happens a lot in simulation, it happens in skills labs, and it happens in a clinical experience, but sometimes we miss it in the didactic content, is really reflecting, letting the students think about what they've just experienced and how it impacts their learning process. So in stage 3, we move into translation of reflection, which obviously why it's so important to have even experienced the reflection opportunity. Taking those abstract concepts and translating them. What does that mean to your practice? How will you use it in the future? How could you have changed your decision making, or how did your decision making impact the outcome that you got? So you start to make these conclusions about what's happening. And then lastly, in stage 4, we use this information to kind of infer on what's going to happen in future experiences. So I then can have a plan. I can pull from these learned experiences when I'm bedside or when I'm interacting with a member of the professional team or working with a family. I can think back on those previous experiences. And essentially what we're looking for is that the learner's knowledge level, their base level, just continues to increase with every one of these defined experiences.
It's so important through kind of that experience. And I'd love for you to expand on why you think it's so important.
Yeah, absolutely. So I think that the first thing that we have to think about from a nursing profession is that you have to be able to you have to be able to use clinical judgment. You have to be able to use complex decision-making skills. The practice of being a nurse is very complex and it just gets bigger and bigger. And in addition to that, we typically have to be able to use observation skills, assessment skills, and then not only did we complete the task, but do you know why that matters? Do you know why that assessment is important? What are the cues that are going to be the relationship between variables? What are you going to tell the doctor or the nurse practitioner or the other member of the healthcare team, and how does that impact the outcomes for those patients? So it's not just about being task oriented, it's about being able to pull all those cognitive skills in with it. I think that most of us know that professional nurses are expected out of the gate to be able to be critical thinkers.
Oh yeah.
They have to be able to take on leadership roles. They have to know all of the roles of the other members of the team. They have to be able to really work in sync with a large group of people. Unfortunately, something that we've identified is that there are a lot of new graduates that aren't comfortable with these skills.
Yep.
So they've been in a nursing program, they've been guided, they graduate, and then they're expected immediately to take on higher responsibilities, larger patient loads, be able to prioritize. And really, that doesn't just come naturally to a lot of people unless they've been asked to do it previously. Another big part, and this is very nursing focused, but we have next gen NCLEX. It's the new licensure exam.
Yep.
And if you've ever talked to anyone who's taken NCLEX, they'll tell you that it is not an easy exam.
No,
and we're about
by no
to
means.
raise, yes, we're about to raise the bar on that. So the next gen NCLEX really is intended to be more of a clinical judgment focused exam. So they'll be given scenarios. They'll have to make inferences and decisions based on the cues they received in those scenarios. And then the case continues to grow. So you can see that if they made a decision or they didn't understand something in a previous phase, it could impact the outcome in the upcoming phases.
Yep. Absolutely. And I know that as the need grows, I know that you have a little bit more to say on this as far as the different research that we're finding. So I'd love to hear a little more.
Yeah, absolutely. We in the nursing profession really hold dearly our frameworks. What we have very clear ideas, standards, and a curriculum that should be included. So we use the essentials, which the new essentials just came out, so that you'll see an evolution with nursing curriculum with that. CUSIN, which are competencies that we expect nurses to really have when they graduate and when they're in their practice, and then national accreditation such as CCNE or ASIN. So those provide really good frameworks for curriculum. But even with all of those frameworks, there are countless studies that show that we still have those deficits. We have the framework, we're not quite getting there.
Yeah, and I know that from being in the space the last few years, and I know that you're not the only one that sees this value. And during your research, I'm sure that you found kind of the effectiveness in these teaching strategies.
Yeah, absolutely. Some of the things that we need to focus on is that the evidence basically shows that there is a deficit in cognitive skills. There's not a deficit in psychomotor skills. Now, we're talking prior to COVID, so we have to be careful to kind of balance that, right? Because we do know that unfortunately in the last 18 months, there's been a deficit in the ability to really have student learners go hands-on. But some of the things that the questions that arise, and we have to kind of work through the literature from there, is, are new nurses comfortable using resources? Do they know how to plan their day? Do they understand prioritization? Are we preparing them for cognitive skills as much as we're preparing them for psychomotor skills? And I think it's very simple to say this, but it would seem obvious that lecture is an ineffective approach, right? It's an ineffective approach to decision making. If I'm just giving information to learners, they're not actually engaging in the thought processes that they need to develop that kind of clinical judgment that we're asking them to do. So there's lots of teaching strategies, right? We know about active learning strategies. We talk about flipped classrooms. There's lots of things that we've asked educators, and I'm sure educators across, not just limited to the profession of nursing, to integrate into their classes so that we can help engage in this type of learning. However, when we're talking about clinical practice for nursing, one of the issues is that what we've used historically is clinical, right? We send a student to clinical, very helpful in the exposure that they get to go hands-on, they get to interact with members of the team. The downside to a clinical day is that it's sometimes left up to surprise, is the best way I can put that. We have no idea what's going to happen during that clinical day. Patient could be completely stable. Student nurse is going to do just what a nurse would do on any given day, but on a slow day, quote unquote. We nurses don't like to use, we don't want to have bad days. So I try to be careful with that. So what we're asking them to do, unfortunately, in these cases is they basically become observers. They become shadowers. They didn't get to use their critical thinking skills because they were in an experience that just didn't ask for that level of cognitive function. We also have to consider the nursing shortage.
Yep.
The nursing shortage causes a huge impact on the number of nurses that are available and what their workload looks like. And the reason that that impacts our students is if I have 8 patients I have to take care of, even if I am the most effective nurse and want to give this learner a great day and help them through those kind of higher level critical thinking functions, I may not have time to.
Right. And based on what you're telling me, it sounds like we're leaving a lot up to chance. It's totally up in the air what kind of experience that they're going to get. And it may not be the experience that that particular learner needs. And on top of that, the variety of ways that we teach, everyone learns a little bit differently. So some people may really need those experiences that may not organically happen. It's incredible.
Yeah, and kind of adding to what you just said, the different modalities that we need to engage in, it allows for that experiential learning theory that we're talking about with Kool, right? It allows for different experiences that may have a bigger impression on one learner over another. So I wouldn't say that it's ever about replacing one thing. We're not asking to replace anything. We're asking to include other learning modalities. And so I think some of the research that really what we have to look at is if a clinical experience is dependent on the rapport that a faculty builds, the experience that the faculty has had there, are they used to that facility? Are they used to the protocols, the policies? How, what type of relationship do they have on the various units? That absolutely is going to impact the learner's experience there. And they may or may not get access to all of the clear objectives that we'd like them to have. We've used simulation, right? Simulation has been around for decades and decades, and it's not new information. But what it does give us is it gives us a way to really ensure that our learners are meeting very specific objectives.
Yeah.
So if I have a student that, they had their clinical rotation, but they never had an opportunity, and I'm going to use a maternal child, a learning experience. Maybe they never saw a birth.
Right.
We can take them into a sim lab and we can ask, and we can show them that. We can ensure that they at least have experienced a high fidelity birth through simulation. We still have that component though, that the student becomes a little bit more task-based because they're thinking through, I've never experienced this before. So now all I'm focused on is, did I do the steps that I was supposed to do in the right order? Did I assess someone? Did I perform the appropriate, medication administration? Did I miss any of those steps? They're not necessarily always thinking through the why.
Right.
In that experience, which is where the debrief comes in. So in addition to that, and now this is where we kind of move into what I would say is the focus of this, is that virtual simulation is the forefront, right?
Absolutely.
It is where I believe higher education is going to go. It offers another modality that fits into that experiential learning framework. So in this case, it's not less valuable, it's a different approach. At this point in a virtual simulation, the students are decision makers. There's no one there prompting them. They're safe to make decisions because A, they don't have to worry about a patient and something bad happening to them like they would in the direct care experience. B, they're not in front of their peers like they would be in a high fidelity simulation. And now they get to think through, why did I make this decision? What happened when I made my decision? I feel psychologically safe to make decisions, and it forces them to become a critical thinker. They become more efficient. They become comfortable. Their self-efficacy increases. Their knowledge acquisition increases. And again, it reduces risks to patients in the long run.
Yeah, I mean, 2020, the need for alternative learning methods, different modalities just skyrocketed. Everyone had to get creative. And I think we ended up stumbling upon something that has been there all along and has been there readily available to assist us in what we do well. Talk to me a little bit about your research pertaining to that high need in nursing. You touched upon it just a little bit earlier, but would love for you to expand.
Yeah, absolutely. It's very ironic. I always joke that my project could not have come at a better and or worse time. So I started my doctoral program in 2019. So in the February of 2019, so well before the pandemic. And so I had identified what this project was going to be and worked with the professor at American Sentinel to kind of start this project rolling. Essentially a year before the pandemic took over.
Yeah.
So what was identified very early on, and it's something that's always kind of been a passion for me, is how do we engage learners in development of skills, cognitive skills that we're asking them to do, but not make it boring? So it's absolutely clinical judgment, and the development of clinical judgment is the ability to observe. It's the ability to identify what is relevant and to identify the relationship between those relevant pieces. That's essentially what we're asking people to do. But it's definitely harder to get clinical placement. I've got to be honest, from my perspective, what I had done in my professional career was one of the tasks, or one of my job requirements, was to help with clinical coordinating. And it became very clear how difficult it is to put students into a clinical experience and ensure that they're meeting all the objectives of that clinical experience. So that kind of was the why behind my wanting to go this direction, if I'm being honest, right?
Yeah.
My self-reflecting on, I saw a problem, but I didn't see a problem from like a learner's perspective. I saw a problem from I'm going to say a tactical or a strategic issue, right?
Yeah.
Yes, absolutely. So what we do know is that if students don't feel comfortable, and I say students, moving into the nursing world, then we have nurses that leave the profession early. They have difficulty transitioning. That impacts patient outcomes. That in fact impacts system outcomes, right? So this is a bigger issue than what I think a lot of people were comfortable talking about. So this project used a quantitative, just pre-test, post-test design. So pretty simple on the grand scheme of what you could do in a research study. It used the Skalski's clinical judgment scale, and really the point of it was, does a virtual simulation impact clinical judgment? Let's see what we find. So in this case, luckily our program has campuses nationally. At the time of my project, there were 2 campuses that were eligible for inclusion. And I needed to have at least a minimum of 34 participants. I thought I'd have about 68. I ended up having about 42. So our program is accelerated BSN students. So the criteria was that they had to be in a BSN program. They obviously had to be over the age of 17, but it included all genders, all ethnicities, ages. There was no limitation beyond that. And they did have to be able to utilize a computer and read and write in English, because the simulation was exclusively in English. So the scale that we used has 10 questions. The questions very much focus on prioritization, delegation, evaluation of management of care, and management of like objective and subjective data. So we asked the students to complete the pre-simulation survey. And unfortunately for me, when I completed my project, I had put everything as it would be a paper pencil survey. So that was a little bit of a hindrance, because we had to shift pretty quickly to figure out how we could do paper and pencil surveys in a time when students were not on campus any longer, because at this point we're now in the pandemic. One of the nice things that actually did happen though with this is that my project was kind of perfect timing. I completed the study over the summer of 2020.
Okay.
So for the campuses that needed clinical replacement,
It's perfect.
this was actually perfect because there was an answer already in place for them.
Yeah.
So the students complete the pre-survey. They then follow up with completing the simulation on their own time.
Okay.
There was we kind of gave them about 2 weeks to complete the simulations. The simulations provide dashboard data, they provide deliverables. It shows the faculty exactly where the students were at and what areas they struggled in. And then after the simulation, they completed the post survey. So that's essentially what the project looked like. The virtual simulations that I used were from the Sentinel U catalog, and they really were focused on development of clinical judgment, prioritization, delegation, and putting the students in a situation where they had to make kind of high volume, high acuity decisions.
Yep.
So we also made sure that this project was implemented into our final semester students. So we didn't have to worry about the level of clinical judgment. These are students that are about to take their NCLEX.
Yeah.
So I got very lucky. My project did show statistical significance. So we did have an increase from pre-simulation to post in the surveys, which is fantastic. You know, it's what every
Yeah.
researcher wants to find statistical significance. But I think something that I found kind of really interesting in the project is that there were a couple of situations where students actually ranked themselves higher prior to the virtual simulation than following the virtual simulation.
Huh.
And I don't have the answer for that, but one of my beliefs or inferences is that when you ask students, do you know how to prioritize, right? They took the pre-simulation or the pre-simulation survey. They said, yeah, I know how to,
No
I know
problem.
what I'm doing.
Yeah.
And then they did the virtual simulation and they were completely independent decision makers. They didn't have anyone else helping them along like they would have in a high fidelity simulation or a lab.
Yep.
And then they realized where their deficits were.
Yeah, absolutely. I mean, you've hit the nail on the head. And obviously you and I are both coming from a space where we can see the impact that it would have on clinical judgment. And you mentioned even the ripple effect there. It is causing a larger problem to not use virtual simulations than some of us even realize. It has a ripple effect on attrition. It has a ripple effect on the amount of time, the confidence, the motivation, all different layers. And with all of that, I see you have queued up some implications for nursing practices. And I'd love to even talk about any advice that you have as we're wrapping up for folks who are hesitant about the virtual world's impact on their curriculum. I know that change can be tricky sometimes. And I think that the MO that you and I both have is that this is meant to improve. So I'd love if you could talk to me a little bit more about that.
Yeah, absolutely. So I mean, the implications I think are very obvious. I can kind of summarize this in that it's twofold, right? We can reduce our clinical footprint. So if I'm a nursing program, I don't have to have as many students in a direct patient care for all of these hours, which allows for different experiences. I do think that it increases, just like I said, the reflection skills in nurses, which I believe wholeheartedly just carries into their practice. And they can stop and think through, like, why did I do that? Or how did that help or hurt my patient? Those kind of things. I think the major implication is that a virtual simulation experience absolutely provides a bridge to to fix that gap between direct patient care, traditional simulation, skills labs, and then heaven forbid we have another pandemic or a global disaster. We have the ability to utilize virtual simulation that's not going to hurt our learners. Even, I guess, kind of further along than that, I want to jump to the recommendation. So there's a couple of big pieces that I think we need to further investigate. So the reality is virtual simulation is new. There is not a lot of research out there about virtual simulation. I am very privileged to be someone who gets to contribute to the body of work that is out there, but I would love to see some studies that compare traditional simulation to virtual simulation and those kind of outcomes and what does that look like. Since I completed my study, there's actually additional gap that I feel like is identified is there's not a lot of research about ratio of simulation replacement for clinical hours. So I'd love to see something what actually does show better outcomes, and does a virtual simulation fall within that 2-to-1 ratio that we're looking at. I think obviously across the body of nursing, we have associate degree programs, we have bachelor's degree, we have RN to BSN. There's a lot of ways we could use this. So I would like to see further studies in that. And then lastly, for me, there are so many opportunities for virtual simulation to just improve nursing education in general. I think public health nursing and community health nursing virtual simulations are great because students don't get an opportunity to see that. And I think they miss that community health nursing is not medical surgical nursing in the community. So I would love to see the further development of something that really influences public health nursing knowledge. But there's so many ways we can act in this place. I think that some of the big wins that virtual simulation offers is that it provides a safe environment. It provides an opportunity for students to be decision makers and not have to worry about the harm that could come to a patient. I would love to see it actually used in new graduate programs, orientation programs, or remediation for nurses. Another part of that is that we as nurses have to do continuing ed. We do a lot of web-based learning type modalities in our, certifications and hospital training. And I think virtual simulation would be a great replacement for that. Instead of just going through slides and answering questions, really make them go through a virtual simulation and make decisions, just like we do with our skills that we use in nursing. I just think at the end of the day, the inclusion of something that challenges a student at a cognitive level is going to have as much, if not more, influence on their success as asking them to be like psychomotor focused. So
Absolutely.
I really do think that this is the answer. The virtual simulation is the answer to kind of high level competencies.
Absolutely. And I thank you so much for the research you've done and being a voice in this space. I couldn't agree more that there is still work left to do in finding out how much impact that this can genuinely have. But that's part of who we are here at Labster. We're empowering that next generation of scientists. And we've got folks like yourself and I'm sure plenty of other folks tuning into this call who are looking to do the same thing. So we're looking to continue the conversation. I appreciate your time today and thank you so much for participating.
Yeah, absolutely. Thank you so much for having me. I love working with Labster and I love what you guys are bringing to higher ed.
Awesome. Thank you. Everyone have a good rest of your day.